and it's in the breaking. We come unbound, and it's in the giving. We are found, yeah. You could barely change, and you don't know how.
Welcome to Wisdom and Well-Being, a podcast created to honor the authentic human experience. Seeking to nourish through stories instead of through substance, we offer this space for the telling of a unified narrative where wisdom, hope, gratitude, and love become our sustenance, and community our home in which to receive it.
You walked on fire, and I know you tried.
In today's show, I share in a curious conversation with two close friends, Allyson Chrystal and Guillermo Ruiz. Together, the three of us share a common mission to remove barriers to wellness through the application of functional, Paleolithic, and holistic approaches to healing. While our educational backgrounds may be entirely different, ranging from allopathic and naturopathic medical training to occupational therapy and functional nutrition, we have come together in this conversation to discuss our visions for the future family medicine clinic. What does it look like? What types of providers should be involved? What kinds of therapies should be available? Is this even possible? And lastly, who's actually running the show? But before we dig in to this dynamic discussion, I want to share just a little bit about my two friends, Guillermo and Allyson. Allyson Chrystal is an occupational therapist and clinical instructor specializing in pediatrics. In her clinical work and research, Allyson is focused on sensory integration and self-regulation in children with behavioral and developmental disorders. More recently, she has expanded her work with self-regulation to typically developing children and adolescents. She is also currently completing her master's degree in functional medicine and clinical nutrition. Guillermo Ruiz is a fourth-year naturopathic medical student at Southwest College of Naturopathic Medicine, SCNM, in Tempe, Arizona. I first discovered Guillermo after listening to his podcasts with Rob Wolf and Chris Masterjohn, and it was obvious, even before ever reaching out, that a friendship was already in the works. Guillermo's aim is to use his research to help advance naturopathic medicine as an evidence-based practice, and he focuses on finding evolutionary connections between our modern and traditional healthcare systems. He is currently a research assistant at SCNM, an associate researcher at Arizona State University Biodesign Institute, where he focuses on botanical medicine research. His hobbies include researching, learning, practicing, and teaching the benefits of adhering to an appropriate evolutionary diet. I cannot express my gratitude enough for these two thought leaders as we all attempt to uncover what we truly need to be nourished, to be joyful, to forever remain whole. Allyson and Guillermo, thank you guys for sharing a conversation with me today. I'm still hoping to meet both of you in the near future, but we can at least start with this electronic friendship. And so just thank you for joining me. And I guess to get things started, let people know who you are, what you're passionate about, and perhaps why we're even having this conversation. And Allyson, why don't you get it started?
Sure, thanks. Well, it's super exciting because I know we're like-minded tribe members, so I'm excited about the conversation that's going to happen. I am currently a practicing pediatric OT, and so the occupational therapy realm is what initially brought me into medicine. I was pre-med and applied to med school and got into med school, and then had kind of a change of heart after some work as a paramedic, and so found OT and have done the pediatric thing, and then always kind of felt like there was something I was missing. There was just pieces of this developmental piece in kids and families that just, there was a void there in practice. And as I was practicing and kind of got that generalized feeling through my own journey with cancer, I found functional medicine and started a master's program in functional medicine. And that's where I think that the world kind of opened. And, you know, people like Rob Wolf and all of kind of that the community that you can kind of reach online and really find out about this movement of evolutionary health and ancestral health and integrated health and holistic health and you know, all the good things that I think I felt like I was missing in practice. So that's my current focus, is combining functional medicine with OT to treat kids.
Awesome. Yeah, it's something that we desperately need. I mean, just really evolutionarily engaged occupational therapists. And I mean, it starts for me with, it starts with kids. Right. And sometimes it can be a little scary to want to approach that population just because of the, the complexity of disease that you can see. Sure. I remember working actually with a wonderful occupational therapist who did a yoga class for both physically challenged and mentally challenged kids. We had CP patients, cerebral palsy patients, right next to ADHD kids. And it was just this wonderful scene to see all these helpers, everyone working together to give these kids a space to be themselves. And, I knew, I was connecting with these pediatric OTs, and it wasn't going to be my future, but I was like, I want to know more about what you do, because this just feels so right. So, thank you for giving us a little glimpse into your story and to your path. And I guess, Guillermo, I feel like every day I keep learning more about you, but please share with everybody, why you're here, what gets you up in the morning, and what you hope to work on in the future.
Well, I got to this functional medicine space, very ones and zeros kind of guy. I like analytical stuff. And I was looking at my health, and it wasn't where I wanted it to be. And I thought to myself, hey, why can't I solve this from a more, from a logic kind of, way of addressing weight issues and things like that. At the time, I was working at an emergency department for children. So I had access to a library, I had access to tons of resources. One of my dear friends, Devin, he was doing this caveman diet. And he handed me Gary Taub's Good Calorie, Bad Calorie. Around the same time, my girlfriend's mom was diagnosed with a rare form of cancer, jejunal cancer. And when she went to the doctor, after I printed a bunch of research linking this type of cancer to a wheat allergy, this oncologist basically took the research and just put it to the side and said, this is nothing you can, you did. This is not your fault. Let's beat cancer. Now, that is a great message. It might be motivating for some people, but the genetics of that predisposer to the cancer are stratified around her family. And to deny people of that information, I saw it almost as malpractice. So then I started thinking, I wish there was this type of medicine where we were addressing nutrition first, and maybe sleep and exercise. And sure enough, through blogs and podcasts, I heard Chris Gresser talk about naturopathic medicine. And I was like, what's that? So I like to say that naturopathic medicine found me, not the other way around. But something that Allyson said, I like the term integrative medicine. I don't like this. What we do, the three of us, is not alternatives. This is not an alternative to health, because you're either healthy or not. This is not alternative medicine. Medicine either works or it doesn't. I think the three of us agree that we're going to strive for our patients to give results. But we are going to be integrative. We have an OT, an MD, and a future ND working together, trying to inform people that there are different approaches to reach the goal. And even in chemotherapy, even in when we're looking for new answers to a disease, we try to attack the disease process from various aspects, not just one mechanistic way. Because if you attack it in one mechanistic way, the cancer is going to become resistant to that, and now you're going to have to look for a different way of attacking that cancer. If we attack that problem from different aspects, then we're going to be able to minimize that problem faster and hopefully find the answer. And I don't care what the one thing that made it better is. What I want for my patients is to get better. And when we talk about integrative medicine, I'm not just talking about substituting herbs for antibiotics. I'm talking about addressing sleep. I'm talking about addressing diet, addressing your environment, toxic movement, and spirituality.
One of the things I love that you said, Guillermo, and I think it really touches on kind of what unifies the three of us. I mean, we have a functional medicine perspective, we have an allopathic medicine perspective, we have a naturopathic medicine perspective. And I think one of the things that is so unified about the three of us is our philosophy of healing and the foundation by which we want to empower patients, and we want to think outside the box, and we want to be so open-minded to, maybe not the traditional way things have always been done, but also very evidence-based. I think that philosophy of healing is universal, and it really is not title specific. And I think that's one of the things that ultimately is going to be really a game changer for our patients.
I like to say that you don't have to have an MD after your name or ND or OT after your name. Mom can be the healer. You heal the kitchen, you heal the whole family. So for anyone out there that is like an undergrad and trying to figure out what to do your passion, inspire people, because that's going to be the biggest obstacle. Trying to make people change their life. Taking a pill is easy. Eating a healthy diet 3 times a day for the rest of your life is not. And unless you are very encouraging and inspiring, your patients are not going to respond. And you can have, you can have, all the intention, but unless you apply it, you won't be able to make that change. And going back to what you said about we have like the same foundation. I think the foundation, we can distill it down to let's remove the obstacle to cure. Mm-hmm. That's it. And if we can remove the obstacle to cure, no matter what modality or what approach, that you're trying to get to, if you can remove that obstacle to cure, that's when you achieve health. Mm-hmm. And we bastardize, this healer, term. A person that prescribes an herb to reduce your sugar in your blood, that's not a healer. They are giving you, they're bandaging your insulin sensitivity. Okay, a healer would be the one that removes the obstacle to cure. In that case, it would be having a better diet. The problem that we have is this. Especially when you have like very specific silos within your own profession. For example, as a naturopath, I can get super geeked out on botanicals. But if a person has plantar fasciitis that is caused by improper movement, I can throw botanical after botanical after botanical. But unless I have someone like Allyson correcting whatever is making them not walk properly, you're not removing the obstacle to cure. And in this case, and the integrative approach, maybe the botanicals are going to minimize the symptoms for a while while Allyson does her work, and then, or changes the environment, or, fixes whatever is wrong. That's when you achieve true health.
Yeah, removing the obstacle to cure. I think you can't distill it down to anything more beautiful than that. And, I echo everything you guys have said. And I think it's a testament to our openness to be having this conversation. I kind of laugh at some of the past few years as I've gone through school, seeking out individuals with different skill sets that maybe just so happen to have different titles after their name, because I recognized I want to meet people that not only have a different skill set, but think differently than me, have a completely different approach to how they see healing and approach the patient. And I put myself in situations where oftentimes I inadvertently would make people uncomfortable, because they're like, what, medical students don't hang out with the OTs for yoga? This, what are you doing here? Or like in the nursing school, spending more time with the nurses and going up to them in the hospital and asking them questions, and discovering that they oftentimes feared some people with white coats, and would rather just talk behind their pagers. And so it was sort of, I was breaking ground in some sense, breaking these barriers, just because I wanted to share a conversation and see how they approached medicine, because I knew it would be different than myself, and would together enhance our capacity to better care for others and remove those obstacles. And I think it's only from that place of openness where we can really help people. And, I envision, and we've talked about this before, the true family medicine clinic of the future, to me, has to have people with these different skill sets, with these different backgrounds. The idea that one MD can provide complete wellness for an individual is, in this day and age, it's just flat out wrong. And I think would be, actually, like you said, Guillermo, malpractice to be thinking you could provide everything an individual needs. And so I think we need to, I'd love to start and get your guys' take on how you see this future family medicine clinic working, and how do we build in different skill sets, whether that's PT, OT, social work, naturopathic medicine. How do we build that into a practical and sustainable clinic?
So I have to share an experience that I had, that now that I look back, and especially with what I know now, it was so revolutionary. And to me, really almost provides a template for exactly what you asked. And I hesitate to date myself, but it's so significant because it was so long ago, 25 years ago, when I was a pre-med high school.
Hold on. 25 years ago. I just turned 27.
So
25 years ago.
So you have Doogie Hauser in the house. She was probably 7 going through pre-med.
I was convinced I was going to marry Doogie Howser, but that's a whole other conversation. When I was pre-med, and my dream was to be a pediatrician, and I volunteered at a children's hospital in Atlanta, Scottish Rite, for a good 4 summers straight. And so I really worked my way around the hospital. And 2 of the summers in a row, I volunteered at something called the Craniofacial Clinic. And this was a very specific center for kids with any sort of craniofacial anomaly. So we had everything from kiddos with a minor cleft palate to kiddos with really, really traumatic and severe injuries to, everything across the gamut, to genetic disorders, all the stuff. So we had what was called a consultation day every week. And on that consultation day, families would schedule months out, people from different countries would come in, and these families would come and sit in this glorious room. And in the amount of 2 hours, they had everyone rotate through, and it was a total of 13 on the team. There was a neurosurgeon, an ENT, nurse practitioners, nutritionists, OT, PT, speech therapist, social worker. There was everything under the sun that embraced this family, stopped in, did their few minutes, took some information. And then we had, I can't even say this, before laptops, there was a desktop computer in the hallway. So each specialist would spend time with the family, go outside, type up their notes, and we would sit down for an hour at lunch and an hour at the end of the day, all around the conference table, and just discuss what was best for this kid. And the families would get this beautiful report, and then it was follow up with the individual specialties. But we had everyone saying, man, I can offer this. what does this child need? How can I help? How can we work together? And you had everyone there on the same page with exactly what the treatment protocol looked like. And as normal as that seemed to me at the time, I'm thinking, man, if we could take a template like that and apply it to something maybe even less rare than a craniofacial anomaly, something like a kiddo with autism, or a woman with breast cancer, or diabetes, or all of those things. And I think the irony in today's, at least what I've observed, is that when it comes to things that are heavy hitting kinds of things, I mean, I look at cancer care and how we have really developed teams that have a similar approach. We're not quite at the ideal yet, but it's a little more integrated. You have nutritionists and social workers and surgeons. And gosh, even when I think of hospice care, there's a team approach, but I feel like there are many parts of medicine, if not the majority of the aspects of medicine that have yet to even adopt or envision or even accept that integrative approach could be so, so powerful for healing.
I think, what upsets me is, patients are becoming savvier. With the advent of laptops and the internet, people are more knowledgeable than people were before, and people want this integrative care. And it turns out that integrative care saves money, because now you don't have the physician doing nutritional advice. Like you discussed with Chris, Master John, Rob, there's not a lot of nutrition education within medical school. And you have a whole profession dedicated, that they dedicate their lives to nutrition. Now, we can get into the ins and outs of what they're learning, and maybe we don't agree with what nutritionists are learning, but that's a different podcast. But so we're trying to create this because people want it. The market is asking for this integrative approach. But we are not fully committing to it. We are just bandaging this thing together because that's what they want. So we have an integrative clinic now, and you have a nutritionist, and you're going to meet with the nutritionist, and the nutritionist is going to have a 5-minute consult with the patient, and they're going to be so terrified of what recommendations they make because they don't want to be outside of their scope. And I think we need a little bit of more freedom within this integrative approach. And what will that look like? Just think about, I used to work at an emergency department for kids. And whenever we had a kid that was diagnosed with type 1 diabetes, a nurse was sent to their house to teach mom what to do because their lives changed. Not a doctor, And this nurse probably knew more about type 1 diabetes than a brand new resident because they had been doing this for so long. That's integrative. Allowing the profession, giving away a little bit of your scope for the benefit of the patient. And that doesn't mean that the primary physician is going to stop being the physician. What it means is that we are allowing the allied health professionals do their job. They went to school to become nutritionists. They went to school to correct environmental factors that are affecting their outcomes in lives. Let them do their job, and charge accordingly. And I assure you that if we truly have the integrative approach, where you have the OTs doing the OT job, when you have the nutritionists doing the nutritionist job, and then you have the doctor as the quarterback, making sure that the nutritionists are giving sound advice, making sure that the OT is doing right for the patient, diagnosing, helping order labs, maybe have health coaches like what Chris Kresser is doing with his ADAPT program. That will lower prices of healthcare, and that is going to increase quality of care. So that's what we need to strive for.
I think it's so well said. And I think at the end of the day, there's a little bit of a supply and demand issue. And I think the folks that we interact with on a daily basis and that we have been, kind of in groups with, understand the language difference between naturopathic and allopathic and integrative and holistic and alternative and all of these buzzwords that we hear or see or read about. And I think the generalized language is difficult for folks to really understand the meaning behind. So for example, this really well-respected hospital right around the corner from me just started this integrated medicine clinic. And I freaked out when I saw the title, and I got online and I was super excited. I'm like, oh, this is what we've been dreaming of. This is the Mark Hyman kind of thing. This is, big stuff. And it's a really effective, cool clinic. But there aren't medical professionals. There's some really cool things. There's Reiki, there's massage, there's lots of supportive health things, but not necessarily the integrated clinic that I would think of. So I think there's some mismatch between the language that we're speaking and the language that the public understands, because there's so many different kinds of, there's so much information out there that until folks know exactly what it is they want and they need, and they know how to term it, I think that demand isn't going to be heard necessarily as intensely as it could be.
Yeah, I agree. I was able to do a rotation actually a year ago. It was one of the first rotations I did in my last year of medical school. And it was in a clinic that called itself an integrative clinic. And it's, like you said, a buzzword. What does that really even mean? And in one building, they had a couple of chiropractors, they had a couple of people doing acupuncture, had a woman doing massage, a guy doing fascial work, really fascinating stuff.
Yeah.
A woman doing a lot of like psychologists there who got to do, we did mindfulness and CBT and some biofeedback. And it was, on paper, a wonderful idea, right? You give these people some space. There's even some naturopathic physicians, and they shared some space together. But it was very obvious early on that the communication between folks was essentially non-existent. And they still had paper charts, and I was looking at the acupuncturist notes, and there'd be no way that the MD, like, SI4Q, you're like, I don't know what this means. What did you do to him last time?
Actually, Rob, it's LI4. Okay, get it right.
And I asked the director about it, and I said, did you guys, do you ever meet and talk about patients? And he said, we used to try to do it, but if you're not speaking with each other to know the progress of treatment, you lose a lot of that ability to really heal. And I'm a dreamer. I think big. I really do. And so in my mind, I would love to have, say 4 or 5 people on my team. So I have myself, say I have a PA, a social worker, an occupational therapist, and maybe even a physical therapist. And let's give an example of a patient who comes in with autism, or even early on suspected autism, 2-3-year-old. And what can we provide for the family? And so we, initiate treatment, and, I can do a diagnostic, can get some labs, and, give some idea of what it is I think might be going on, and at a sort of physiologic disturbance level, see how we can support you with some supplements. But then, I want to bring in my PT to start doing some, and so if there's any issues with, movement-based issues or any functional impairments, and I want the OT to come in and maybe even go to your home and see what's your home environment like. What are the other kids? Let me give you potentially some, therapy in the home, help the parents out, and see what we can do from there. And then, when you come and follow up in the clinic, maybe you can see my PA, because you'll be able to get more time spent. And we meet, say, weekly, bi-weekly, to talk about our patients. And each of us gives our say about what we're doing for them. And at any given time, the emphasis of treatment may be, right now, actually, this individual needs more help from our OT. And so from an MD standpoint, I might really not be involved at all. And it's being willing to delegate, share that language, and recognize that you don't need to be the quarterback of the ship, or at any given time, being the one providing all of the care, but you need to speak together and see where we need to put more of our resources to help an individual. And because, if you're just working with someone individually, you get that sense of a little bit of guilt. Like, if I'm not helping them, I got to keep working harder. There's something I'm doing wrong, rather than like, oh, great, I have someone right here next to me, within the same clinic, within the same complex, no barrier to entry. Let's work together. Maybe their services are going to be more helpful for you, but we're going to be speaking together, same language. It's not like I'm sending you off to some random specialist who's going to look at your knee. And so that's what I see and I envision. And I hope from a business standpoint that it's practical. I mean, I know people are trying to do it now, and we've given glimpses of practices that are doing it, but be curious to get your guys' thoughts about your willingness to want to work in an environment like that, and and being open and delegating work. And do you see that as a viable clinic, as a viable model?
Well, go ahead. Go, ladies first.
Yeah. Age before, just kidding. I'm going to come back to that. I think that is incredibly ideal and not idealistic. In other words, I think it's the possibility is absolutely there from not only a reimbursement perspective, but I think there's many more of us in the medical profession and entering the medical profession that have kind of checked our egos at the door, and are really becoming a little more self-aware and humbled, and understanding that the piece of our pie is not the entire answer for our patients in so many cases. And I think the traditional theory that, you go to a professional, you get a fix or the often desired quick fix, and you leave and everything's better, is not the reality of disease. And it's also not the reality of current healthcare, or, a kind of coordinated care. So I think it sounds like I would love to see something like that in place. And I don't think that's, from a financial perspective and a reimbursement perspective, that's impractical. Guillermo?
Well, even so at the clinic, we have, as naturopaths, we learn so many modalities, okay? And we learn botanical medicine, we learn physical manipulation, we learn, mind, body, we learn all of these different things. And when a patient calls, okay, let's say they call in for back pain, who's to say, so they get assigned to the shift that does back, physical medicine, because you're interested in physical medicine. So you sign up for that shift, and you're going to, probably see more physical medicine. But who is to say that physical, that back pain doesn't need some mind-body work? Who is to say that physical pain is not coming from a bad living environment? If you think that you don't need OT work, you are erroneous. Everyone could benefit from some OT work. If you don't think that you would benefit from some myofascial release, you are wrong. Everyone could benefit from some myofascial release. If you think that every problem can be solved by a prescription, you are again wrong. Because sure, prescription medications are amazing for certain things, and in the short term, we should use them. I am a big proponent of prescriptions when necessary, and sometimes prescriptions are for long term, sometimes not. But I don't think that any of this, they are professionals for a reason. You're not just waiting for that autistic patient, to be referred to the OT. I think everyone benefits from some mind body. Everyone benefits from some OT work. Everyone benefits from some myofascial release, physical medicine. It's the optimization of health. Now, when someone goes to the doctor, they don't go to the doctor to optimize their health. They usually go because they're sick. So you said that that in my vision of this integrative care, your primary practitioner, whether it's a MD, ND, chiropractor, anything, they're going to be the quarterback. But the quarterback sometimes knows that pass defense is too strong for your game, so you're going to have to run the ball. And
you lost me. Sorry.
and you just hand it out to the person that is going to score. And I think the egos are gone. The days of the doctor shows up to the hospital and the nurses stand up are long gone. They're not coming back. And we know exactly now where we stand. Sure, we have a bigger scope. We can order labs and we can make a diagnosis. That's cool. But we also, if you want to be a good practitioner, you're gonna have to know when your job has ended. And maybe that back pain now needs a PT. Maybe that back pain, maybe you've corrected that acute phase, and it's going to be both financially more responsible for the patient to go to a PT or a massage therapist or an acupuncturist than continue to pay those. And that's the problem with our healthcare right now. We overutilize the most expensive aspects of healthcare because we're just trying to cover and not get sued.
Even going back to my point about patient education too, is that I think we're very conditioned, and as I was with, my cancer journey, is you're very conditioned to, well, if I have X, I go to this specialist and I get the thing taken care of. And even as something as I don't know, generic as, let's say, a thyroid imbalance, I went to my annual doctor's appointment. I got some funky TSH and some really low T3 or whatever. So I'm going to go to my endocrinologist and get a prescription. But no one is helping patients understand that there's a nutritional aspect.
Yep.
And there's another whole axis of hormones that may have an effect. And there's an environmental toxin axis. I mean, there's multifaceted root causes of why that thyroid hormone is off balance. And I think one of my missions is to educate folks who maybe haven't heard that multifaceted analysis of disease yet. And they might not understand that, every disease has lots and lots of different aspects of cause. And so therefore there's lots and lots of aspects of treatment. And so I think that general push to help the public understand that there's not a singular, narrow mind, or not, singular kind of avenue for optimal health.
Dr. Alan Christensen, he makes the analogy that if your car breaks down, the carburetor is not working, you take it to the mechanic and you fix the carburetor, and then the tires are worn, so now you go to the tire place. And sometimes in medicine, the carburetor might be broken, and you fix the carburetor and all of a sudden your tires come back. So like your thyroid, you were talking about your thyroid. Maybe you don't need thyroid supplementation. Maybe you're so stressed that that's affecting your hormonal output. So by going to someone that is going to help you cope, and because it's almost impossible to get rid of stress, maybe by relaxing and having mindfulness and having a meditation practice, and maybe you will end up controlling your thyroid symptoms. Now, this is not going to be the case 100% of the time, but it could be an outcome. And that is, again, it's going to be more cost effective than thyroid endocrinologist.
And more long term.
And more long term. Right. Totally.
Yeah. I was just reading a study this week that it's funny how these things kind of come together. I was actually reading it a day after I spent some time in a local family medicine clinic, and we had a drug rep come by to talk about a antidepressant. I always ask about if they carry any research and any research reports for me to look at. And I was digging into some of the numbers to see, this difference between clinical significance and statistical significance, how, what's it effective. And then just so happened the next day a study comes across my computer, and they were looking at depression as well, but we're actually looking at a randomized controlled trial with a dietary intervention as well as a social support intervention. And I was like, they're already using the same scale. Now I'm curious, let me go in and see, the difference that they got from their intervention on this exact same scale. So just to put this in perspective, this scale, for instance, we won't get into the details. It's like a 60-point scale. The drug, or the two drugs that I found, they found a statistically significant difference of change of like 2.5, which, if you look at it on a 60-point scale, 2.5 is really not that much. And, but yeah, statistically significant, p-value of less than 0.05, but, maybe not that meaningful. This dietary intervention, put this in perspective, had a difference of 12. And so the dietary intervention had a difference of 12. And get this, the social support intervention, which I read a little bit more into, and we'll get into this in a second, had a difference of like 5. So, these people a lot of them were on some form of drug, some form of, pharmacology, and a few of them were getting psychotherapy. So this was, add on to that. But, a difference of 15 versus 2, and a difference of 5 versus 2 to 2.5.
And the social support intervention, I read about it, was basically like they just had a friend. They described like they would play cards, they would paint. They had like 8 hours over the course of 2 months. And it was like really just they had someone to spend an hour with them once a week to be their friend, and just talking, enjoying. And that had a huge added boost. And I won't say it was, increasing the effectiveness of the drug. I'll just say there was an added synergistic effect with all of the therapies they were getting. That was bigger than the drugs alone. And
what was the CPT code for the friend?
Man, I was gonna say,
how do you feel a friend? How do you feel it?
And exactly. And so I look at that and I'm like, this is, if you could sell this in a bottle, like maybe if this was a drug, you would be all over it. And the same with the dietary intervention. And so I look at that and I see, well, how do I structure my clinic where I can put my resources so that I have people to be able to provide this training, provide that dietary support, and to provide the social support. And for me, I think about, I'm in an academic community in Charlottesville, Virginia. There's tons of brilliant, smart college kids, and tons of which who are pre-meds and are dying to do some sort of volunteer work or work in a pre-med field. And I'm sitting here like, why aren't we using you guys? Why don't we, bring the community together? Like, you would be the best social support befrienders on the planet. And if there's that clinically meaningful of an effect with spending 1 hour with someone a week, and maybe if it's even electronically through FaceTime, if I can find a group of people at a fairly low cost point who are willing to invest in patients to bring about that kind of significant change, I mean, why wouldn't I do that? I mean, it seems insane to not try to build your clinic. And then the same thing with like, why would I not bring people, dietitians, nutritionists, to support and do this 8-week intervention if it had that big of a difference? But yeah, I would just, I kind of went a little tangent there, but it blew my mind to look. And I was like, this is just proof that this is where we need to put our research.
I would love for you to write that up into something.
Yeah,
people
send me the link to those.
Yeah, I'm working on a blog post now to try to make it relevant. Good. But it was just like smacking me in the face, like this is mind-bogglingly
and I think you could probably list 10 diagnoses, and if you found you would find very similar kind of dichotomies between the studies and not that pharmacological intervention isn't amazing and necessary in a lot of cases, but the statistical significance of the different kinds of interventions, I think, would blow most people's minds, as it just did mine. And that,
well, I don't remember what the drug was, but I think that we're having a discussion on this drug, and it was 27% effective, and it was like used for rare cases. I don't remember what the drug was. Placebo has a 30% effectiveness rate. So you give placebo or this drug. It was statistically significant, but it only worked 27% of the time. Placebo works on average 30% of the time. So that's kind of funny. But to go back to your social support. So I have a patient in one of my shifts, and she suffers from anxiety attacks. And she was having a very bad anxiety attack. And on the internet, and maybe I'll look, I have a link and I'll send it to you, and maybe you can put it in show notes. There was this service where people volunteer to text you if you have an anxiety attack. And it was 3:00 in the morning. And she grabbed her phone and texted this random stranger, and they walked her through breathing exercises, walking around, and that anxiety attack went away. And Reddit has a subreddit called Suicide Watch, and there's volunteers are on, and if someone is thinking about doing that, they can log in and post their problems, and a random stranger is going to just talk. These are not trained professionals. These are just random human beings doing some great, volunteer work. Imagine if we could harness professionals like nutritionists to, if you don't know what to cook, if you're down to your last $20 and you can just log into your computer and talk to a random nutritionist, and they'll say, what, these are the choices, don't let any, perfection be the enemy of good. But if you make this choice for your diabetes, you can make it with those $20. And if we could harness that, and like you were mentioning, with is it the nutrition aspect that helped this patient, or was it the friend, or was it the drug? I don't care. Research is amazing, and it can give us a lot of insight into what is working, and I have published papers, but when it comes to actual live human beings, if you have someone with shoulder pain and I do manipulation and dip tissue and prototherapy and maybe acupuncture, and that person went from not being able to use their shoulder to full range of motion in less than 3 or 4 weeks, I don't care what the thing that made it work. I just want that patient to feel better, be out of pain, and avoid an opioid addiction. That's what I care about. And it's very hard to publish anything that has multiple modalities because there's a lot of confounding factors. What made it better? We don't know. We don't care. As long as people are getting better, I guess we're going to have to figure out a way to make this an evidence-based outcome. But I think we need to look at this model of N equals 1. What modalities did you use? What was the outcome? And try to extract information off of it to inform people that monotherapies work for some things, but multi-therapies, regardless of what was the highest thing that made that outcome, work better because of synergism.
So guys, I guess, we could keep talking for hours and hours, and I would love it. But to bring things kind of to a close, I want to give you guys just one last sort of kind of open-ended piece of anything that you would like to share that, maybe a topic that hasn't been addressed as much in this space, but something that you think, planting a seed or a conceptual framework, something that you think you can offer our audience as a way to help them nourish themselves, but also bring more strength to their work or to their environment, wherever it is that they may be.
I can go first, Allyson.
Go for it.
Okay. So for everyone out there, listening, that, if you are in pain or if you are sick and you want to get better, you are not crazy. If you don't feel like you're optimal and you go to your doctor and you ask for, a little bit, something that's a little bit more sophisticated than a 5-minute visit, ended with a script, and you don't feel like you've been treated correctly, keep looking. Don't give up. If you have to become some sort of practitioner to heal yourself, that could be, a good idea. If your passion is medicine, but you are disgusted with the way we practice, you just get off your seat and change medicine. We can do this. We need more people out there that is going to be fighting the good fight. And listening to podcasts like this is a very good start. Do not get discouraged by a practitioner that maybe is burnt out. Maybe they got into medical school because they had good grades. And that was, everyone told them you should be a doctor, and they wanted to be a painter or a dancer. And that's not their passion. And look for someone that agrees with you. Look for someone with a license. That's very important because that license is going to give you a scope. And as long as that person is practicing within their scope, that's going to be safe for you. Look for this integrative approach and be your own advocate. Be your own advocate. And if you do end up in that place where you find a good practitioner that is going to be working with you, then do your work. Then if you have to, if their recommendations are uncomfortable, they're giving you that recommendation not because they're mean. They're giving you those recommendations because they want you to get better. Follow the instructions, and I assure you that you will eventually find health, because no one deserves to be sick.
Well said. I'm over here clapping. You just can't hear it.
Yeah, clapping here too.
Right. Man, I think you said so many good things. And I think one of the concepts that helps me explain, I'll use the term holistic health to patients, is, when you're not feeling optimal, I think, well, let me back up. I look at health as kind of this Venn diagram of overlapping circles, right? And one of the circles is the physiology of the person, and one of the circles is the environment that they're in, and one of the circles is the tasks that they do every day, and one of the circles is the people that they surround themselves with. And when all of those things go really well, that middle juicy part where all the overlapping circles are is true contentment, happiness, satisfaction, and health. And I think when we don't feel right, we tend to go right to that physiology circle, and we tend to try and get that quick fix because we feel as though that's the only part of that diagram that can give us the best outcome. But I think as patients and as humans, we need to really address all of those aspects of care, the environment that we're in, the things we do every day, both movement and nutrition, the people that we surround ourselves with. And obviously in all of those circles come things like stress and job and sleep and light and nature and all of those good pieces. But I guess my final thoughts would be that as much as we are talking about this integrative model of healthcare and the practitioners that are taking this wide lens, which is ultimately going to really lend itself to better health for the patients, I think we as individuals need to also cast a wider lens as we evaluate our own sense of balance and therefore our own kind of optimal road to health. So I would encourage folks to kind of zoom out a little bit from that physiology and really understand and appreciate the role that all of those different aspects of a lifestyle have in terms of feeling good. Because like Guillermo said, we all deserve to be, to feel good, to have good health.
I loved that visual. I'm a very visual person, and I may be stealing those circles. And, oh my gosh, that's a lovely image, and
brings it all to yeah, for sure.
Thank you guys for sharing this space. I always come back to, at the end of the day, I ask myself, two questions. Did I continue to hold a space for healing? And am I doing what I love? And if I don't have a good answer to those questions, then I kind of revisit what in my life is misaligned. And I'm just so grateful to hold this space. And I hope as many people in the variety of backgrounds and healthcare and whatever profession can hear this and realize that we're at least sitting at the same table. We may be wearing different hats. We may have different letters after our name, but we are sitting at the same table.
You might be in the pocket of Big Pharma.
Yeah. Yeah. And there's more seats open. There are more seats open. And I hope we can just continue to invite people and hold this space and do it without judgment. So thanks again, guys. And yeah, let's get something on the books soon where we can all hang out and share a real human in-person conversation.
AHS, man, AHS.
I think it sounds like a
Hey, dude, it's like 3 presenters.
Yeah.
All 3 of us are presenting, man. So AHS
Seattle in September.
Yeah.
Well, I guess, do you guys want to just close this out with how people can get in touch with you? I know you guys have your own wonderful spaces and amazing followings, but just share for the people in this audience, how they can get in touch with you.
Sure. So my website is www.evolutionarytherapies.com. And there's some good foundational information as well as ways to get in touch. That's probably the best way.
Man, that's a great URL. Jesus.
That's some good advice.
My website is 3030strong.com, 3030strong.com. I'll be at PFX, at PaleoFX, present. I'm going to have a panel with Dr. Bobs. Tony Federico is going to be moderating. Emily Schrum is going to be there. And then I'm going to have my own talk on the 5 botanicals to keep in your paleo medicine cabinet. And then all 3 of us are presenting at AHS. So that's going to be very, very exciting. And I also have a podcast, the 3030 Health Podcast. And you can reach the podcast through 3030health.com.
Yeah, so definitely check out Guillermo's podcast. Thanks again, guys. I hope you guys have a wonderful evening. And yeah, I'll start counting down the days until we get to September. So
Yeah, that's going to be awesome.
until
Thank you,
next
Rob.
time,
Thanks, guys.
be well.
Thank you for your presence and willingness to receive a new narrative, a passionate perspective, and perhaps a deeper sense of connection with our collective purpose. Please share this podcast with any and all that you believe will benefit from its intention to relieve one's doing and engage one's being. Please share your comments about the conversation on our podcast page and leave a review in iTunes so that the voices in this space can spread to all ears ready to receive it. Music credit goes to Dillingham for their song Vessel. Remain open, stay curious, and forever be love.
You walked on fire, and I know you tried.